So we're going to discuss the current options, I guess new options to renew your EMS certification, to renew your New Hampshire EMT Intermediate license. And you know that in the past the process has been to take a refresher training program. You've taken the BLS refresher training program, so 24 hours plus ALS content that you get elsewhere, maybe at the refresher, but ALS content, so another 12 hours. Plus 36 hours of continuing education, other continuing education, all to equal 72 hours of education over a 2-year period. The other option that you've had is to take the National Registry's exam in lieu for the EMT intermediate level, and if you're able to successfully pass that, then you basically don't have to take any hours of continuing education during that time period. So those are kind of like the two different ways to do this. A couple of new things to be aware of. Actually, now we have approved an RTP, which is an intermediate RTP. Most of them tend to be ones that are upgrading folks to the AEMT level, which I'll talk about in a little bit. But if you were to attend that, you could still use it for the EMT refresher. So 36 hours of that refresher plus the other continuing education hours of 36 equals 72. Now, kind of new this year is the ability to do all of your refresher education through continuing education, and let me tell you how that works. So the National Registry kind of breaks it down into two different components. You can take where in the past you've had like basically 36 hours worth of refresher time, and you could have done it through 24 hours of basic and 12 hours of ALS. But basically refresher component that they would look at of 36 hours, so they look at that, then plus another 36 hours of continuing education. So 36 hours and 36 hours of refresher, and we can do it all through continuing education now, if you want to do that. The refresher content, where in the past it has been the responsibility of the instructor to determine what they are, now it's your responsibility if you're going to pursue this. And there's certain categories and certain number of categories and hours that the National Registry wants you to fulfill, so we need to make you aware of that, and we can talk about that next. But the main thing is that you can do all of this through continuing education now, and not take a formal state-approved refresher program, and that may be an advantage to some folks, may provide some level of flexibility, which they didn't have in the past. Other folks may find it more difficult to do, more record keeping and things like that. But it is an option that's out there. Now let me tell you a little bit more about this refresher component here, because I think that's going to be important for you to understand. Let me just clear the board here for a second and get that ready for you. So here's how the National Registry breaks it down, and they break down the refresher component, the 36 hours of refresher component. They break it down into mandatory content and then flexible core content. And I guess the difference, mandatory content, they have certain things within each of these hours that you have to cover. And in the flexible core content, they'll give you the number of hours, but the choice of what to cover is a lot more flexible for you. So let's just take a look at what the National Registry requires. So for airway breathing and cardiology, in the mandatory content, they they want 6 hours. Under the medical emergencies, they want 2 hours under that. And again, kind of an example under the mandatory content, in this 2 hours, they want you to cover the assessment and providing care to a patient experiencing allergic reaction. That's one of the bullets that they say you have to cover in this 2 hours of mandatory content. As far as trauma, they want 4 hours worth of trauma. They want let's see, 6 hours worth of kind of combined OB, pediatric, infant care, and then they don't require any hours as far as operational under this particular section. So we've got a total of 18 hours under mandatory content. And again, you'll need to go through and take a look to see what those are, and I'll tell you where you can find that in a minute. Under flexible core content, we need the hours, but they're less prescriptive about what you're going to cover under that. So under the airway, breathing, cardiology section, they're looking for 6 hours under that. Under medical emergencies, they're looking for 4 hours. Under trauma, they're looking for 1 hour of content. OB and PD, 6 hours. And then operational issues, 1 hour. So operational could be anything, preparatory, MCI, incident command, worker safety, things along those lines. So that's 18 hours of content. So that's a total of 36 hours. 36 hours of refresher content that they are going to be expecting you to do. And I would suggest that you go to strongly suggest that you go to the National Registry's website to take a look at their brochures. So nremt.org, or you can just Google NREMT. And on their front page, it has a section, a link that says refresher recertification information. And you just click on that, and you can click on the brochure that deals with your particular level, and it'll give you a little bit more about the breakdown of this information. So now just remember that in addition to the 36 hours of refresher training that you're taking by continuing education and not through a refresher training program, in addition to that, you have to have 36 hours of other CEUs. Okay, so again, total of 72 hours in your 2-year refresher cycle. All right, now there's a couple things that I kind of need to caution you about. So let me clear the screen and just tell you a few things that you really need to be aware of. So the first caution, the first thing that you need to be aware of is that, as you are, I'm no doubt aware of the upgrade in the national standards from EMTI to the AEMT level. And I want you to be aware that in order to be able to upgrade to this level, you really can't get this information through continuing education. You have to go through a refresher training program that is specifically approved to provide the transition content. Again, and transition meaning the transition from the national level, not the old New Hampshire scope of practice type transitions, but basically the conversion content to bring you from the EMTI 85 to the new AEMT curriculum. So that needs to be done through a refresher and not through continuing education. All right, so you need to know, not through continuing education. You need to make sure that sometime in the next 2 years, or I'm sorry, not 2 years, but the next 2 refresher cycles, that you do have one of these refreshers and not do them both through continuing education. So again, just to remind you that if your EMTI license expires on odd years, then you have until 2015 to upgrade to the new AEMT level. If your license expires on even years, you have up till 2016 to get that done. Now, just to further confuse things, or I just want to tell you that you can, for one time only, you can take the exam as a challenge. One time only, you can take the AEMT exam, cognitive exam, without taking a refresher. All right, and if you successfully pass that, then you can upgrade to the AEMT level. If you attempt that and you're not successful, then you still have to take, sometime in the next 2 refresher cycles, you have to take a refresher to enable you to take the exam beyond that. Because remember, you have to take the AEMT exam, cognitive exam, to move forward up to this particular level. All right, I know you already are well aware of that. So that's sort of like the first caution. The second caution that I need you to be aware of is, I guess you have to look at it this way: is kind of validation of the education. So validation, in the past when we've given approval for instructors to give a refresher program, we've had a level of being able to determine whether the education that they're giving is valid or not, is good education, and by allowing folks to do it through all continuing education, we sort of lose some of that ability to validate it. So we need to keep that. That's an important part of what the Bureau requires. How are we going to do that? Well, we're going to do it through random audits. So any provider who recertifies using all continuing education and not doing any refresher training program component will be subject to a random audit. And it's not a punishment, it's just a way that we have to be able to determine that there's good education going on out there. So if you're chosen for an audit, there's a couple levels that we're looking at. One is that we're just maybe looking for a list of the information or the education that you took, and that could be paper list, it could be a copy of your National Registry certification, it could be something from your training officer. Just tell us what you took, where you took it, how many hours, that type of stuff. All right. We may be looking for certificates. If you took a course at a conference, we might be looking for the certificate indicating that you were actually there. I mean, we're gonna not have as intensive a scrutiny on content that you get from, say, your medical resource hospital or conference, EMS conferences, the North Country Conference, the Central New Hampshire EMS Conference, or content that comes from a New Hampshire licensed EMS instructor coordinator. We may be willing to take that on face value. However, I want you to be aware of a third level that we may require of you, which is to look at the kind of like backup documentation of a Con Ed presentation that you put down for refresher training. All right, so documentation. All right, now this is not necessarily documentation that we're going to expect you to keep, but this is documentation that we're going to expect that instructors are going to complete and keep on record, so that you can have access to it should you need it. Let me explain that just a little bit more in depth. Let me just clear the screen here a sec. So for content that you're going to use for your refresher, so the 36 hours of refresher is what we're concentrating on, not the 36 hours of additional continuing education. But for the stuff you're going to be using for refresher, it's perfectly fine for you to get this education through your local service and such. It may be through somebody that we don't necessarily know who they are. We don't know what their credentials are. So we need them to be able to come up with a certain amount of backup paperwork. And we'll be telling folks about this, and so it's not going to be a surprise to them. But the information that we're going to be looking at is things like objectives. We want there to be clear learning objectives that are in writing for this particular program that you're attending or that they're giving. We want to know what the credentials are of the individual who's doing the teaching, that they have the expertise to actually teach on the subject that they say they can. We want to see that. The location, we want to know when, where, what time that the educational offering occurred, and we're going to want to see a roster. Now again, this is not something that you need to keep. This is something that the instructor needs to keep, but you may need to go back to the instructor and say, hey, the EMS Bureau is looking for this information, you need to send me this, and they need to go ahead and do that. Now, that brings up a topic that, in essence, it's not the instructor's responsibility to I'm saying that wrong. Basically, it's your responsibility to make sure that the content that you have that you're going to use for a refresher component of your refresher is good, valid stuff. So it's basically a kind of a buyer beware type of issue. You being the buyer of educational services, buyer beware. Make sure that the instructor that you're getting this information from is a good instructor and complies with what you need. Ahead of time. Talk to that individual. Say, look, are you doing what the Bureau requires for education, and can I get that from you in a year or two if in fact I need it? And if they can't say yes to both of those, then you need to maybe take a pass and find a different source of education for this component. You can certainly use this component for other continuing education. But if you're going to be using it for the refresher component, it has to be at a bit of a higher standard. So you need to be able to make sure that they can produce this information. If you're unable to do that, then you may be in a situation where we take action and suspend your license until we can figure that out. So big time, buyer beware. Be talking to these folks ahead of time, saying, look, I need you to have a high level of documentation of just these 4 things. This isn't a lot to ask for, so just be aware of that. I guess that's it for now. I spent enough of your time. I hope this was helpful and has answered some of your questions about the current mechanisms, the new mechanisms to renew your National Registry of EMT Intermediate, and then ultimately your New Hampshire EMS license if you're a New Hampshire provider. If you still have questions, please, I encourage you to go back through this video again, and if your questions are still not answered, please give us a call at the New Hampshire Bureau of EMS and ask to talk to an educational specialist, and we're glad to help you out.